Okay? So this is, no, there's a name for this. You don't know what kind of drape this is. It covers, it has a certain opening, but it's also covered with film.
Aperture.
No. So there's no opening. You have to create an opening. So we got fenestrated drape. You guys know what that is, right? And the incise.
Incise drape.
Yes,
Yeah.
incise drape. Okay. So we got fenestrated drape, aperture drape, plastic. So you can use aperture drapes for eyes also, but you also get to use incise. You guys will see a lot of incise drapes. We'll literally have to go here, pick this up, and make an incision. So be ready with scissors and pickups when you guys are draping. Okay. Draping can be as simple as 4 of these 10-10 isolation drapes, clear isolation drapes. You guys remember these? Just remember when you pass them, make sure you pass them again. Me, you, same thing. So the sticky side, it's going to be the side you want to pass to the surgeon, me, you. Okay? So in that case, if it's me, sticky side is on my side, me. So when the surgeon receives it, he receives it this way, so he can go ahead and place it down. Again, you'll put 4 of these around. Last one here. So you can go ahead and place it 4 for isolation. Okay? Alright, next what's going to follow is, again, usually the eye drape, there's directions on it. It'll say place on eye, right? Or to have a little circle there. So that's the part you're going to lay down. You're going to lay right down on there. The doctor's going to do that, by the way. Stick it to the drape. Down, down, and just like we do, cover yourselves towards the feet first, and then towards the head. Once you have this down, okay, the next thing is going to be to apply possibly a U-drape. Some doctors will work off of this just and just go, but some doctors, especially with ENT, you're going to want to use some sort of ENT pack or eye pack, and just like this one, it has a U-drape, right? It sometimes has a bar or a head drape so it can go at the top part. Remember I was talking about a U-drape can work with anything? This is usually covers the U, creating the U, making it now opening, okay? So how do you apply the U? When you apply a split or U-drape, okay, the base is usually going to be right where it says, base of incision or at incision. This is where it's going to be. Usually with your fenestrated, the opening was the base of the surgery, right? But in this case, since it's a U, it's going to be the base of the surgery is here. What does that mean? You guys seen painters do this, right? They're looking at the entire portrait. So what you're doing with the U-drape is saying, looking at the portrait, or in this case being the incision site. And the incision site is going to be the patient's eye. So if we go this way, we'd have a lot of drape going this way. So we usually come in this way, the U. Again, we don't do things backwards, right? We do things like a book. So the U is again coming in also this way. If you want to do abdominal, you can do this, right? Making sure you see the belly button. If you want to use an arm, you can go ahead and do it this way, or even this way, to encompass the arm. In this case, we're going to just go this way and encompass the arm. So, how do you apply drape? Solo. I'll go solo this time, right? Sir, sticky on or off? Sir said no. I don't want it. You come here and you apply it at the base. Okay, what's the base again? That's the base of the surgery right there. Grab it, make sure you don't contaminate by looking down. Some of you guys felt to do that during the final. Grab this guy, let it fall. Right, both arms are down. And more than likely for these eye surgeries, they don't have the headrest. The headrest is probably a shoe rest or U, kind of to hold the head, some sort of device to hold the head, or there's detachable pieces that just detach at the shoulders and then just leave the headpiece, okay? So let these fall, but keep this one up. Always keep your side sterile if you can. And all you have to do is when you're applying solo, is grab yourself here, start pulling until you can't anymore, okay? And if it starts peeling off, you've gone too far. So let's just leave that there and drop this. Bring the U's out. Okay, see, we can still go a little further. Bring the U's out this way. Right over here, making sure you don't contaminate. Come out. Bring these over this way. Now I can't come forward because all this is now sterile. And you can step it. With the U, you want to take these off. Please don't be like Elliot throwing stuff on the floor. And that's your circulator. We'll leave them on the edge back here so the nurse can come grab them. Thank you, Merce. It's a man.
Did I already key someone's car?
It's all universal nerves. You grab this over here, pick it up, don't let it fall. Hold here, and then you pretty much follow the sticky part so you can continue to. Over this way. Say follow, follow, follow.
Do we press on the head like that?
Yep. And what I do, this is the way I drape, by the way. I drape. Alright. All I do is hold here so it doesn't come down sterile. Bring this over this way. And now I don't even have to use the bar drape. All it does is create a nice little drape. That's what I like to drape versus Dr. Says, that's nice. And then on top of that, you can put another piece if you want, like some eye band or some sort of eye type inside drape again, if you like to, okay? They sell these little pouches where you literally, they look like those ones that I showed you. You place them here and they have a little water pouch. You guys will see, this is gonna get nicely wet. Alright, and then your nurse can come over here and fix this so it doesn't, alright? I'm gonna bring some towels there.
I have some extra, or we had some extras. Yeah.
Alright. So it'll be something like this, similar to this, guys. This is over draping it. Again, I want you guys to learn how to over drape compared to a simple little bit, job. Okay. Your microscope might not be sterile. The only sterile that there is on here might be the actual objective lens and the little hand pieces. Okay. You might have to put on an objective lens, sterile piece, and hand pieces that you'll slide on. Down the road, once we get like into neuro stuff, guys, we will start draping these big kind of things. So I do have microscope drapes and I do have C-arm drapes that we're going to start draping. This guy, I'm trying to keep him in. You guys, anybody know what this is? I forgot the name. Okay, I knew earlier. But it's pretty much a traction type thing. So it helps the patient pull themselves up, or blah blah blah, or help with moving, so that way you can tell the patient, go ahead and pull up while we continue to move you. Exercise and therapy. So it's a pull-up bar, literally. Your nurses come in with this so your patient can get up, help themselves up, or if they need to do something with the back real quick, so they can just pull themselves up. It's a pull-up bar, kind of for your patient.
It'll always be on the chain like that. It'll always be dangling on a chain like that.
Yeah. All right. So this is not what you'll see for ophthalmic surgery, okay? So when you guys come up here, this is the only part you guys can touch. Try not to touch too much of this. If not, I got alcohol wipes so we can wipe these down, okay? But they've been pretty clean. We've been taking care of this. Let me find the packet that I left here somewhere. All right, so doing eye surgery, all right? Surgical tech, bring this over here. Make sure your kick bucket is somewhere where you need. This is gonna go up here. Machine more than likely will be the same side as your microscope. So you'll toss this off. Here you go, nurse. Slide, slide. Always making sure you don't touch the machine. I'm going to go ahead and secure that. Cool. Back table. I'm going to go ahead, even though it'd be the other way. Right, this setup. Just want to leave it so they don't move it. You bring it around right here. So this is there. Your table's over here, and your main stuff is here. You shouldn't have to go over here for anything except for load and grab your lens. That's the only thing really where you should do that. All right. So how do you do this? Again, you got to be as fast as possible. You got to use both hands. At the same time, you got to keep the eye hydrated.